realize that the payments, the reimbursement from Medicare to rural hospitals and doctors, they get paid $20 a procedure less than those in the South. And our snowbirds go to the Crosby Clinic, to Virginia Range Medical Center, to the St. Mary's Clinic in Duluth and elsewhere, and get their checkups in October, and their prescriptions filled, and then they go to Harlingen and Sun City, and they go to Naples, Florida, and spend the winter in the warmer weather. But they do all their medical checkups here first, and get their prescriptions filled, because the medicine is better, but the reimbursement is better down south. We have to equalize that, because our hospitals are losing in Minnesota $1 billion a year. And what's happening? We're losing our doctors to southern states, and to New England, and to California. And it's great to have the family farm, but it's just as good to have the family practice in medicine, to have the clinic in your hometown so you can be treated properly. And that's what this debate is all about. To have critical access hospitals in rural areas, you know, they don't put a limit in Minneapolis, St. Paul, right down here in Twin Cities area. They don't put a limit of 25 beds on any one of the hospitals. They've got hundreds of beds. But we have a 25 bed limit in small communities on the number of beds that small town hospitals can have. And that limits your revenue, limits your ability to compete, limits your ability to attract and retain a surgical practice in small towns. That's what this debate is all about. Who can have medical care? What's it going to cost? I've heard all this hoopla up from the other side, and this all during August when there were these so-called tea parties. Well, I didn't have any of those meetings. I saw no reason for me to call a rally for the Republican Party. I've heard from my constituents for 35 years. I know what they think. I've heard from them. I have advocated universal coverage, single-payer health care system for 35 years. No one's kicked me out of office. And that's what we need to do.